welcome to the Riverain booth. My name is Alan Hunley. I am the VP of Channel Partnerships and Business Development for Riverain and the ClearRead CT portfolio of solutions. Joined today by Matt Rockhold, CCO of Thynk Health, and then Isaac Palat, the Executive Director of Imaging at Baptist Health. So today we're going to be focusing on patient management and the impact of an end-to-end lung cancer screening program, as well as touching on incidentals and being able to track patients, have an understanding of where they are at all times throughout the patient journey. So appreciate you both for joining today.
Thank you.
So Matt, I'm going to hand it to you. Let's start with a little bit about the why around the market, the segment. When it comes to patient management, why is it impactful? And then we'll touch on the solution, the Thynk Health solution specifically, and then some use cases at Baptist.
Yeah, perfect. Thank you. Thanks, Alan. And I think really from kind of the high level, like Alan said, there are increasing volumes of imaging coming through the systems all of the time. And so the manual processes that have been and are still in some systems is just not scalable anymore. And so at Thynk Health, truly what we have done is we've really been able to automate the findings, the trackings, the follow-ups for providers that are doing lung cancer screening programs and or incidental finding programs through chest CT scans and or incidental finding programs with MRI scans or ultrasound scans. So, I mean, with all of that being said, we do integrate through the EHR systems, and we really keep providers and patients connected. So the communication from radiology to pulmonology to the navigation system really stays coordinated throughout the patient's journey. And I think really just kind of one of the things that's kind of up on the slide as far as some of the tracking that we do, but I think what I'll be excited to get Isaac to talk about is really the stratified work list that we provide and how valuable it is to the navigation team. And we've been proven already to be able to reduce missed follow-ups by over 50%.
I love it. And you mentioned MR. I know we're speaking about lungs specifically today, but seamless connectivity, interoperability, some things you said there, right? When it comes to AI in general and technology, sites want to reduce vendor footprint. They want to reduce IT infrastructure. So again, focusing on lung today, but quickly, you mentioned MR. Thynk Health, you're able to do an all-encompassing solution, not just for lung, but other modalities and disease states, correct?
100%, yes. And we'll dive in a little bit more into those incidentals here a little bit later, but ultimately, any of those HL7 messages that we can connect to with each and any modality, we can pull that data. So with the front end of Riverain's ClearRead solution, it's really bringing it all together.
Yeah, I love it. Again, interoperability, connectivity, you mentioned the front end solution, the ability now today where our goal and the top conversation is how do we have a comprehensive solution end to end. The goal is to touch every phase of the patient journey, from detection through survivorship. And we can start doing that and help push more nodules into the Thynk Health platform for immediate follow-up, capture the patients for treatment, and ensure we can help create a stage shift, right? Let's find more stage 1 and 2, not 3 and 4. 100%. And one of the ways we do that is through the Riverain technology, ClearRead CT, for computer-aided detection, characterization, classification of nodules, and our unique suppression technology to enhance confidence, reduce nodule search time, and then be able to get those findings. You mentioned HL7 again, to be able to get those findings into solutions like Thynk Health so we can track those patients all the way through survivorship, make sure they're coming in year over year. Very, very important so they're not falling through the cracks per se. Look at the vessel suppression technology here, running through slice by slice, but also some of the structured report down on the bottom is very important to note because that's what's sent into the Thynk Health platform. We're able to get the findings into Thynk Health. So the nurse navigators of the individuals running the platform or managing the patients through the care continuum have an opportunity to look at the findings, the measurements, the lung rad categories, et cetera, and move them to next steps. We also offer coronary artery calcification and lung tissue analysis for emphysema as well.
And I think, thank you.
I'm going to hand this over to you.
Just from a quick kind of overview, I just wanted to be able to share a couple really snapshots of the centralized command center that we provide to the navigation team. And really these are a few different dashboards. I'm really excited to get Isaac talking more about their success. But ultimately, if you're a lung cancer screening program there at the top, you will be able to see, all of the patients that are enlisted, and you'll be able to have some actionable items that are going to be highlighted on maybe who to follow up with and who has missed a follow-up and who's late, depending on maybe essentially, like we were talking about, a lung RADS 4.
Right.
Let's just say we've missed, or a lung RADS 2, or a lung RADS 1 that just needs some follow-up. We're able to put it right in front in a local command center for the team to really follow up with and stay coordinated with. The bottom piece, I guess it's kind of in the middle, and if you can see it, there's some red blocks and some kind of cream-colored blocks. But I think I just wanted to highlight really in a lung navigation system in general, the red boxes are really actionable. So the navigation team, they can provide management over a lot more patients, but we're able to give them really just the actionable places to go take follow-up maybe, or go to a primary care physician because they haven't heard back from somebody. And so we really provide some red, hey, stop, action items, and we continue to just give them that back-end tracking of the whole system and the whole program.
And Matt, when we talk about it, we're talking about lung cancer screening, but there's also incidental identification, right? We want to be able to do this on all chest CTs or all modalities, as you noted. When it comes to the dashboards, when it comes to logging into Thynk, a nurse navigator, are both dashboards in the same location? Are they able to access both easily, toggle between the two? What does that look like for a nurse navigator? Because that's the most important thing. You mentioned the manual entry, right? When being able to track patients through a spreadsheet is tedious. It's exhaustive. So what does it look like in terms of the dashboard for the navigator? Are both in one place? Can you move patients from incidental into screening? Talk a little bit about that.
Yes, simple and easy. And if you want an in-depth demo, please come see me after this presentation, because we'd love to be able to show you that. But essentially, from a navigation piece, and I'll love to have Isaac talk to what his team has really seen too. It's very simple to go between lung cancer screening or incidentals.
Love it.
I just kind of put up another just snapshot of what it looks like from an incidental finding piece. What really models or modules do you have turned on? And this just gives you, hey, how many patients are in each of those programs? So it's a centralized dashboard for everybody on the team to work on and work towards to provide better service that ultimately provides better follow-up, like I said before, really captures on an incidental side, really captures some downstream revenue that is locked up because potentially the patients have fallen through the cracks. So we're able to keep patients in front of everybody with automation and the follow-ups, and continue to really work on earlier cancer detection, no matter what part of what organ of the body we're talking about. So I guess with all of that, I would love to just give it over to Isaac.
Yeah.
We just pulled some data from what he's done and used at Baptist, and I'd love for him to talk a little bit more about it.
So I joined Baptist in 2020 in the midst of COVID, which was an exciting time for us. And I took over what is considered the retail imaging portion of it, and your roles expand after a period of time. But we had 3 main facilities that I oversaw, and each one of those facilities was doing something a little bit different. They weren't reporting to the ACR in a timely manner. They would have to print out their own letters. They would have fold them, sending. When they came back, nobody knew to follow up on them. Nobody to contact them. So we partnered up with Thynk Health a little bit shortly after I started, and we just wanted a platform so we can capture those and bring those patients back to our organization. We initially started with about 5 facilities. We're up to 7 right now. And basically there's been a linear growth, as you could see, as the baseline versus the follow-up. And that's the key. I mean, we are out marketing baseline. But once somebody's in the program, we need them somewhat to be followed up on. And what we have done actually is we've actually hired a navigator. She's a CT tech, so she understands the lingo of the scores, and so she has been monitoring these patients. She works with the dashboard, which is it's huge, and it allows us to go back, send back to the physicians that say, hey, it's time for your patient to have their follow-ups, whether it's 3 months, 6 months, 12 months out. And if it's past due, it also flags us, so it puts it to our attention as well. So, hey, we need to go out there and get these patients and get them back into the system. We understand we're going to lose patients to other facilities just because of the change, they're changing healthcare, they're insurance-wise. But if we can capture these patients, and as you can see, the linear growth that we have had over the course of 5 years, we were doing about 70 lung screeners a month. Last month we reported almost 700 cases. So our growth is steadily going upward, and has made a difference in our follow-ups, in our downstream revenue. And especially with, hopefully, the turn on of incidental findings will change this as well. The reason we haven't turned on incidental findings is we don't know what to do with them as an organization. A lot of these patients they're seen in the ER. What do you do with them? Because they're using the ER as a primary care physician, right? And they go in there, and those ER physicians may or may not be able to follow up. So we want to find a system, and we are working on a system, hopefully, that once they're identified through the system and we know where they're at, we can refer them to our centralized type of scheduling system or referral system. So we're not referring everything to one particular physician, but we can kind of spread it out and have it close to home. So you don't want patients to drive hours away to come to a location where a physician could see. So we're working on that. Hopefully within the next 2 months we'll have launch our program, and that way our program will take off even further and identify patients. Working toward implementing Riverain. Our radiologists are super excited about what they can bring to the table and how it's going to change the way our patients are being taken care of and identifying more and more lesions.
Yeah, I mean, you look at the baseline exams and the growth year over year over 5 years. I mean, without something like Riverain, right? It's going to show 30% improvement in terms of reduced missed nodules. Time to treatment can go down as we look at efficiency and being able to reduce nodule search time. So we would expect those numbers just to continue to grow, right? And these programs are multidisciplinary. There's a lot of physicians involved, navigators. When it comes to efficiency, Isaac, and your thoracic team, your pulmonary team, has it improved efficiency in terms of that? The synergy between all the departments, whether it's a tumor board, et cetera?
So we've all come together. We also are starting to do some ion surgeries as well, which has definitely changed and actually made our pulmonologists and our thoracic surgeons more excited about getting these cases and working them up. So that's definitely has helped our program. So it's every department is in kind of blended together to make sure we're taking care of our patients.
Yep. It's all connected, right? More nodules, you're going to do more ion, you're going to do more oncology treatment. Again, back to stage shift. Let's find more in stage 1 and 2, open up the door for more treatment options, most important.
100%. I was just going to say, kind of as something else that, just the future of cancer detection, and obviously I mentioned the imaging volume continues to go up, and the need for automation is there. It helps coordinate all of the different teams. It helps put every patient in front of the navigation team so nobody falls through the cracks. And it just holds another level of accountability to the entire team to do the service of following up with the patients. I think Isaac mentioned it, I just wanted to highlight it. Initially they were thinking they don't know what to do with incidentals because who's going to take it over? Who's going to have the ownership? That's what Thynk Health does, is really helps coordinate all of that communication so everybody stays on the same path.
We went from no navigators to 1, and then we just increased it to 1.5.
Wow.
As soon as we turn on the navigation, the incidental findings, we'll know we'll need at least another 1 FTE incorporated into this program because we need to make sure these patients are all taken care of.
Thank you for saying that. I was going to ask just the volume. It's essentially been one navigator that has really worked through all of this. So I'm glad you said that.
Yeah. Well, no, and I think we've encountered in the past, you've had a navigator for mammo, you've had a navigator for lung, you've had multiple navigators, FTEs at the facility. But when you implement software like this that can automate some of those exhaustive and tedious tasks, well, the hospital can see a reduction in FTEs as well. So to add on to the downstream revenue message that you mentioned, Isaac, also. So thank you both. Again, we touched on the why, right? What's important with patient management? Why are you doing what you do? And then also when you look at the seamless integration of CAD to patient management all the way through survivorship, you can really touch every phase of the patient journey with one solution, and it's awesome. So thank you both for joining. Isaac, I appreciate the use case and real-world examples, and then Matt, thank you for joining as well.
Thank you very much.